The main learning, I think, is that school feeding programs can serve as a platform to support children and their families in these conflict-affected areas. And that these small improvements, just adding one box of milk, that's 120 milliliters a day, can have really big and meaningful impact over the short term.
Welcome to Global Dispatches, a podcast for the foreign policy and global development communities and anyone who wants a deeper understanding of what is driving events in the world today. I'm your host, Mark Leon Goldberg. I am a veteran international affairs journalist and the editor of UN Dispatch. Enjoy the show. Today's episode is produced in partnership with the CGIAR Research Initiative on Fragility, Conflict, and Migration for a series that examines what works to improve the well-being of people in fragile and conflict-affected settings. CGIAR is a global partnership that unites international organizations engaged in research about food security. We are calling this series From Fragility to Stability, and in today's episode, we examine how a novel school milk program in Yemen is fighting food insecurity and achieving other impressive results. You'll hear from Adeeb Qasem, Director for Economic Development Initiatives at the HSA Group, and Lily Bliznashka, a research fellow at the Nutrition, Diets, and Health Unit at the International Food Policy Research Institute, IFPRI. To access this episode and other episodes that are part of this series, please visit globaldispatches.org. Enjoy the episode. Well, welcome, Adeeb and Lily. I'm excited for our conversation today. Adeeb, I wanted to start with you. Can you share with the audience what are some of the key drivers and impact of food insecurity in Yemen today? Just sort of paint the food insecurity picture for us in Yemen today.
So, Mark, Yemen, unfortunately, is going through a protracted conflict. It's now been going for over 10 years. That left the population in a really dire situation when it comes to food security. So about half the Yemeni population are actually food insecure. Malnutrition is actually prevalent amongst Yemeni children, and children specifically are prone to mortality, morbidity, and malnutrition. So there is a lot of need on how we can address this situation. The country is heavily dependent on humanitarian aid, but that has been dwindling over the last few years with all the other conflicts going around the world. But the food security situation is also very dependent on the resilience of the private sector and its ability to continue operating in the country. So Yemen is dependent on about 90% of its food being imported by private sector actors, who then go into distributing it across the country through a network of over 50,000 small retailers that reach all across the country. So this high level of dependence on imports also mean that the country is vulnerable to external and global shocks. So things like the Ukraine-Russia conflict that has direct impact on food security in Yemen, and then the COVID that has direct conflict effect on food security in Yemen. So you can see there is a conflict situation that makes the country very vulnerable. And then you have on top of that, all these global shocks that could really make the situation more dire.
And so, Lily, this is the context in which you crafted a study around adding milk to a school food and feeding program. Can you tell us what you researched, why this study was important, and what you learned?
So, as Adeeb mentioned, Yemen has suffered a protracted crisis for quite a few years now. But there are other acute and protracted crises around the world, and some numbers suggest that about 500 million children globally live in conflict-affected areas. And we know that school feeding programs operate in one form or another in many countries in the world, almost all of them, and that they work to improve children's education, health, and nutrition. But we have very little evidence from conflict-affected settings where we want to quantify these impacts and to really understand how programs are working, how to improve them, and how to reach more children. And in terms of improvements, there's also a need to test the acceptability and the feasibility of different improvements while we pilot them and understand how we can take these programs to scale. And so last year, IFPRI conducted a feasibility assessment in Yemen to understand how to improve the school feeding program. And one of the things that came up from that feasibility study is that families and children really wanted to see the addition of a drink to the existing school feeding program. So they were receiving these biscuits that are fortified with nutrients to support children's nutrition and growth. But children didn't really like them. They found them dry, difficult to swallow and to chew, and everyone wanted to see some drink added, whether water or juice or milk. And leveraging the findings from this study is how we connected with Adeeb and the HSA group and designed this study to add a box of milk to the school feeding program and to see whether that is acceptable and feasible, how it's working, and to really assess the impacts and the costs of adding this box of milk. And this past year and a half, we conducted an impact evaluation to test the effectiveness of adding milk. And this impact evaluation used a very rigorous study design that allowed us to attribute changes to the addition of the milk study. And so in the 2023-2024 school year, over the course of 4 or 5 months, IFPRI implemented the study and HSA delivered the milk program in 42 schools in the Al Muqa district in Yemen. And we interviewed about 1,300 families, the children and the parents, to really understand how the program was working and what were the impacts.
So what did you find? What were those impacts from adding a box of milk to children's lunches?
We actually found a lot of really exciting positive impacts on multiple outcomes for the children and their caregivers. For children, we noted improvements in learning scores. So we administered literacy and numeracy tests, and we found improvements in cognition. So things like the Raven's progressive matrices, which is a test that's very popular around the world. We saw huge improvements. We also noted improvements in physical and mental health. So physical health, that's, symptoms of morbidity like fever and diarrhea and how the children are physically doing. Mental health, we found improvements in children's behaviors, so fewer problematic behaviors as a result of receiving this improved milk program. And for caregivers, we found huge improvements in food security for the family as a whole, as well as the caregiver's mental health that we likely attribute to having more security about where the meal is coming from, the fact that the child's going to school, among other benefits from receiving the school feeding program. And really, these impacts on mental health are really important and really exciting. This is probably the first study to show such impacts and to highlight how school feeding programs and these kind of simple incremental changes can make a huge difference for the well-being not only of children, but their families as a whole.
I mean, Adeeb, it seems just surprising and interesting to me that something as simple and straightforward as adding a box of milk to children's lunches would have such profound impact, not only just like positive educational outcomes, health outcomes, but mental health outcomes as well, as Lily noted. Do you have an understanding of why that is?
If you may allow me, I want to go back to, I think, a very interesting aspect of this collaboration between us and IFPRI and Tetra Pak and all the other partners that came together to make this initiative possible, which is that this initiative is actually a true collaboration and partnership that is cross-sector. So we have HSA Group, a private sector partner, and then we have Tetra Pak, an international private sector, and then we have IFPRI, which is an academic or research and policy research institution. And I think the way we came together into working on the specific at the same time was very interesting. Part of it was this ongoing work. We have been working together with IFPRI for a while on understanding the food security situation in Yemen, understanding the impact of things like the Ukraine-Russia conflict, and then what did that have an impact of food security in Yemen. We did this big forum where we brought a lot of local partners for Yemen, international NGOs, private sector, and we tried to understand how we can unlock the power of partnership to address Yemen food security crisis and strengthening the food systems in Yemen. So as we were doing all this work together, the idea of we were exploring HSA and Tetra Pak, we were exploring new ways we can add impact in terms of when it comes to food security in Yemen, and using our specific capacity in terms of our factories of producing milk, our ability to reach the farthest places within Yemen, and then bringing in this insights on how we can develop this pilot in a way that lends itself to research, and how can this outcomes be of value not just for us as we develop our food security programs, but that could be of value to whomever trying to improve the food security and school feeding programs in Yemen or in similar situations of conflict. So I think it's very interesting that we managed to do this together, and we do it in a way that allowed us to get research and strong evidence out of it, and then to have also a positive impact, as you were talking about, which was surprising because the duration of this actually pilot was quite short. It was only a 5-month interventions, but we can already see the value of adding this milk to the high energy biscuits that the children were already taking.
Yeah, I mean, it sounds like leveraging IFPRI's research acumen and using that in combination with HSA's reach throughout Yemen by dint of the fact that you're a large private sector organization really did have a positive impact, and it's a model you could use going forward. Are there other parts of the food security landscape in Yemen that you think are ripe for further research and ripe for future potential collaboration?
Indeed, I think there is a lot of areas that require much more looking into and developing evidence for. And I think the fact that this is probably one of the very few, if not the only kind of evidence-based rigorous study on the school feeding programs in a humanitarian setup is an indication that we need to do more in terms of how we look at the programming, and then how we really look into how we capture impact using evidence-based methodologies. As we work together with IFPRI, we're also developing new interventions. So our collaboration led us to starting this pilot, which lend itself to this research. We are all now working on new programming, for example, looking into improving the high energy biscuits through fortified whole grain, working with the Fortified Whole Grain Alliance, and seeing maybe that will have another positive impact in terms of nutritional value to the children, but also in terms of probably reducing costs and so forth going forward. We are working with other partners also as we look into the dairy value chain itself and what we can do on that end, and improving smallholders, farmers' production of milk. And maybe we are about to launch a pilot, and that pilot could lend itself to evidence development and research. So we are improving our programming, and we're building on the work we did on this initiative, and we're looking forward to new ways that we can add value to local communities throughout Yemen.
And Lily, I wanted to turn back to you with a similar question. What are some of the implications of what you've learned in your milk study in terms of what future priorities might be worthy of investigation in terms of combating food insecurity in Yemen? Like, what's next on the research agenda based on what you've learned from this study?
So, as we've been highlighting during this conversation, the study was very short. It was over the course of 4 to 5 months of the school year, but we did see huge improvements in children and families' outcomes. And so, the main learning, I think, is that school feeding programs can serve as a platform to support children and their families in these conflict affected areas. And that these small improvements, just adding one box of milk that's 120 milliliters a day, can have really big and meaningful impact over the short term. And so thinking about other conflict affected areas or humanitarian settings, because we do see a lot of humanitarian crises related to climate change, among other things, that, school meals and school feeding programs can serve as platforms to support children during these crises, and that they can be incrementally improved at smaller costs than kind of delivering more comprehensive programs that may involve, for example, cooked meals and so forth. But there is still a lot to learn about how to deliver these programs and how to improve them and how to sustain impact. So I think within Yemen, for example, the next steps, as Adeeb mentioned, would be thinking about how to improve the program further by producing whole grain biscuits or localizing the supply chain. It would be important to study the cost and cost effectiveness of doing these improvements, as well as to look at impacts over the medium and the long term. So we know what things can look like over 5 months, but what would be the impacts over 2 school years, 3 school years, or so forth? What would be the impacts of localizing the supply chain on the local economy, the local communities? And what is the range of impacts that can be achieved? How can they be sustained? And how they can be further improved over the long term? And even within Yemen, the food security situation is very different in different parts of the country. And so testing these types of pilots in even more food insecure areas is also important to understand how things can be improved there as well. I think these learnings are important because they help us learn what we can do over a short period of time in a very difficult setting and how to use research to help us learn about program implementation. IFPRI is conducting a workshop and roundtable in a few weeks with school feeding experts from around the world to kind of think about the agenda of school feeding and what we need to learn as a global community around school feeding programs, where we'll be sharing these findings and discussing more what are the key evidence gaps, particularly in humanitarian settings and conflict settings, and what is it that we still need to learn about school feeding programs and how to improve them.
And Adeeb, any final thoughts on what you've learned from this collaboration with IFPRI?
Actually, there's two last points I want to add. One is, I think, a fun and relevant fact about the setting of this pilot, which was taken place in the city of Mocha. And Mocha is a Yemeni city and port that was actually the first port to export coffee to the world. So we just wanted to highlight that so the next time you hear the word Mocha, you know where that word came from. But I believe the work that we have done is the cross-sector collaboration, show how we can achieve more by working together. This committing to principles of doing well by doing good, and then the power of partnerships. This program could have happened in so many ways, but for us to come together, for everybody to be there at the right time, and then to guide us as we are trying to execute this project and how we can set it up in a way that allows us to really capture the impact and then use that to improve our work and also to allow others to learn from it. I think there is a clear value there of bringing together, working as partners for food security.
And Lily, I'll give you the last word.
It's been great working with the School Milk Initiative, with the HSA Group and Tetra Pak. And I'll take this opportunity to also mention that WFP, the World Food Program, was a big partner on this study as well, as they're delivering the core biscuit program in Yemen. So it really does take a big consortium of different sectors and different types of organizations to deliver this type of program in a really difficult setting. And one of the, I think, best parts about working with Adeeb and the HSA Group is really to see the ability of the private sector to deliver the program quickly, on time, as planned, and really to execute the implementation at a very high quality from the start. That is often one of the most challenging parts in these types of settings. And so it's really been a pleasure to work with them and to see the program implemented so quickly and so well.
Well, Adeeb and Lily, thank you so much for your time. I really do love these stories of impact, so thanks for sharing.
Thanks, Mark.
Thank you, Mark.
Thanks for listening to Global Dispatches. The show is produced by me, Mark Leon Goldberg. It is edited and mixed by Levi Sharp. If you are listening on Apple Podcasts, make sure to follow the show and enable automatic downloads to get new episodes as soon as they're released. On Spotify, tap the bell icon to get a notification when we publish new episodes. And of course, please visit globaldispatches.org to get on our free mailing list, get in touch with me, and access our full archive. Thank you.